Hello, this is Dr. Andre Broussard, and I wanted to update you on a study that's going to be published in a journal called Spine. The title of the study is Does Maintained Spinal Manipulation Therapy for Chronic Non-Specific Low Back Pain Result in Better Long-Term Outcome? Now, the thing about this Spine journal is that they are one of the leading subspecialty journals for the treatment of spinal disorders. So it's a very respected orthopedic journal. And this is one of the first randomized studies published on maintenance therapy using spinal manipulation. Now, what they did was they wanted to assess the effectiveness of spinal manipulative therapy, which is one of the primary modalities used in chiropractic offices, for the management of chronic non-specific lower back pain, and to determine the effectiveness of this therapy in the long-term reduction of pain and disability levels associated with chronic lower back conditions after an initial phase of treatment. So basically what they found was that they did a certain set of treatments in this first group that had basically a sham treatment. It wasn't a real manipulation. Now it hasn't been published yet, so I'm not sure what sham treatment that they used. In the second group, what they did was they did the spinal manipulative therapy for a short term and then quit. They just did it for 4 weeks and then stopped and then followed those patients. And then the third group of patients, they did the spinal manipulative therapy and then they continued with the maintenance care every 2 weeks. Okay, so that's basically how they set this study up. Now, the results. The patients in the second and the third groups, that's the real treatment groups, experienced significantly lower pain and disability scores than the first group, which is the sham group, at the end of the 1 month period. So they were all treated with 1 month of sham treatment, 1 month of SMT, then stopped, then 1 month of SMT and maintenance every 2 weeks. Now, they found that only the third group was given the spinal manipulations on the maintenance program, and what they did was they found that it showed more improvement in pain and disability scores at the 10-month evaluation. In the no maintenance spinal manipulative therapy group, the mean pain and disability scores returned back to their pre-treatment level. Okay, in other words, if you didn't continue with the manipulations, the back pain returned. So the conclusion is that the spinal manipulative therapy is effective for the treatment of chronic, non-specific lower back pain. To obtain long-term benefit, this study suggests maintenance spinal manipulations after the initial intensive manipulative therapy program is warranted. So this is something that chiropractors can base their recommendations on for using maintenance spinal manipulative therapy for people with chronic lower back pain. Again, this is Dr. Broussard speaking, and I hope this helps.